Welcome to Almost Here, Round the Corner Future Technology podcast with Richard Jacobs. Future technologies poised to transform our lives for better or worse are the focus of this podcast. Almost here means these technologies are now here and starting to be used, or just around the corner, from Bitcoin to artificial intelligence, 3D printing, blockchain, virtual reality, and more.
Hello, this is Richard Jacobs with the Future Tech Podcast and the Future Tech Health Podcast. My guest is Dr. Charlton Woodlys. He's the founder of the Woodlys Foot and Ankle Center in Texas. The website is woodlysfootankle.com, and Woodlys spelled W-O-O-D-L-Y. So how you doing?
I'm doing well. Thank you for having me.
Yeah. So tell me about, I know you deal with feet and ankles and common podiatrist type stuff, but I can also see that you're doing therapies that most podiatrists don't seem to do. So tell me a little bit about your clinic and what the therapies are that you do that are unique.
Sure. So started my clinic, let's say, in 2007, and basically I was trained traditionally by doing open surgical procedures. And when I say open, I mean we'd make large incisions. For example, if I'm going to fix a bunion, I'd make a large incision, and we'd use screws and pins to hold the bone in place. And, it worked, but it was always a longer heal time, and they always had a lot of pain, and we were always prescribing these narcotic medications, and I just knew there had to be a better way. And I had a mentor back when I was in residency who used to do these procedures called minimally invasive surgical procedures. And it's not something that we were taught. The anatomy is the same, but the techniques are different. So we do these procedures through little small half-centimeter incisions on the foot. And what makes them intriguing is that I could do these procedures in the office setting with a fluoroscope. Yeah, and it really saves you a lot of money because, when you go to the hospital, you know that you're going to be hit with the hospital cost, the anesthesia cost, the nurse cost, the cost of gauze. You're going to be hit all those costs. So our procedures we don't use any general anesthesia or might give a Valium to those people who have high anxiety. But for the most part, we just numb the area of the foot that we're working on. So we have this thing in the office called a fluoroscope. And the fluoroscope is like a live X-ray. It basically allows us to see the bone real time. So through those small incisions, I use small instruments to go in to the bone areas and soft tissue, remove the soft tissue from the overlying bone, and I'm able to remodel that joint, mainly for a bunion, without those large incisions. And
so
what I find
for bunions. Yeah, for bunions, what are you noticing as the difference, like recovery time, level of perceived pain, et cetera? How different is it?
So the main difference that I see is because, when the traditional surgeries, you're literally opening up the foot. So when you are cutting all the soft tissue and you're making an incision that's a good 7 to 8 centimeters, or sometimes even longer, depending on what you're fixing. What I find is that without that soft tissue being cut open, there's less pain, there's less swelling. I don't need to put you in a cast. There's no screws. I don't use any screws or pins or anything like that. It's not needed. Literally, you walk out after the surgery. Of course, you'd be in a walking boot but I usually keep people in a walking boot. That's like one of those boots that go up to right above your ankle, and it takes pressure off of the surgical site. Keep them in there for about 2 weeks or so. And then from there, I put you in a surgical shoe. My goal is to have you back into your regular shoes in about a month.
That's amazing.
Compared to
traditional surgery. Yeah, how long is traditional? What do you have to go through with traditional surgery?
Traditional surgery depending on the procedure, there's hundreds of types of bunion procedures, but on the average, I would say anywhere from 4 to 6 months is your healing time. Your pain it's not even comparable. Pain and swelling And the results are. I actually think my results just by are better because one, I don't. When you cut that soft tissue, it swells and you get a little bit of disfigurement for a while. So that minimally invasive procedure, actually you have less swelling, and it allows for a better cosmetic heal, but less time. And that's what people want because you got to take time off work, and we're trying to not have you take all that time off work or be off your feet. Just especially people with kids and or have responsibilities.
Well, I had knee surgery like 20 years ago, and if you have any weight-bearing joints or parts of you, your foot, your knee, your ankle, and they get affected, I mean, it's bad. It's really hard to get around, and people want to sit up or stand up. They don't want to lay with their feet elevated. You can't do much of that.
But even think about the knee surgeries that they did, back in the 80s and early 90s compared to now. Now they use arthroscopic procedures to repair knees a lot of times, and it's the same principle as the procedure that I use in my office.
Yeah,
so
great.
Yes, and there's less chance of infection because the wounds heal. The surgical scar heals a lot quicker than the large opening that they cause with the bunion procedure, the traditional bunion procedure.
So what are some procedures that this has opened up for you to do that maybe were never even done, or they were done but they were just really debilitating and now they're a lot better?
So one procedure in particular that I do, and I push it a lot because I think this is a wonderful procedure, especially for people with flexible flat feet. So when the flexible flat feet, they just don't affect the foot per se. So especially with my patients, I try to basically equate it to a pyramid. If you think of your body as a pyramid, and your feet are the base of that pyramid. And if I take a couple of bricks off of one side of that pyramid, it affects the pyramid because it leans, and it affects the pyramid all the way to the top. Your body is like that. Some people having back pain, hip pain, knee pain, neck pain, all of those things can be attributed to a flexible flat foot. I have people come in to my office with severely flat feet. And they tell them, well, my orthopod has told me that my knee pain is causing my foot pain. And I look at their feet, and I'm like, well, it's probably not your knee causing the foot pain. It's your feet causing that knee pain. So I use a procedure called Hyprocure, Hyprocure. It is a minimally invasive procedure. Again, can be done in the office. And it's basically a stent that treats something called hyperpronation. Hyperpronation is a position that your feet go in where your ankle bones actually lean inward, and a lot of times it's like you're walking on the inside of your feet, the inside portion of your foot. So this stent basically acts like a doorstop. It goes into something called the sinus tarsi. It's a little canal. And it acts like a doorstop. It stops you from hyperpronating, from your foot rolling in. It's a wonderful procedure because you walk out that day. It is a titanium stent that there's no cutting of bone. It goes in that canal space, and it actually stops the hyperpronation.
So it acts like an arch. Is it an insert that goes in there?
It's an actual titanium stent. It's like a little hardware that goes in the canal. It does not, it goes in the canal, and it does not cut any, you don't cut any bone or anything. It just sits in the canal. Yeah. And basically, your soft tissue grows around that stent, and it gives you the correction that you're not going to be rolling your feet over or to your ankles anymore. It corrects the flat foot. Right. It gives you an arch, actually, and it balances you. I like to call it internal orthotic because a good example is because orthotics, the inserts that go in your shoes, they do help. Even though you do roll a little bit. That's why I asked you
to compare them.
Yes. So the problem that I have with the orthotics is, one, they don't fit in everybody's in all the shoes that you want to wear. Sometimes you're limited to the type of shoes that you want to wear. Also, they don't really block all of the pronation that's needed at times, and it's basically user. It's up to the user, the person who makes that orthotic, if they depends on their expertise and how well they correct you. So that's always up in the air. With the HyproCure stent, I like to call it my internal orthotic because as soon as you step out that shoe without your orthotic on, you're going right back to the hyperpronation. You're having that deformity. With the stent, as soon as you step down, you no longer have that hyperpronation. So we are correcting that hyperpronation all the time, as opposed to, when you're just in a certain pair of shoes. Or if you want to walk barefoot, you got to get up in the middle of the night and walk to the bathroom. You're still pronating.
Right, yeah. No, I have flat feet, and if I, before I got orthotics, if I look at my shoes, they wear, in a diagonal pattern. I don't know if I pronate in and out, I don't remember, but yeah, I see what you mean. And for me, it's uncomfortable to walk barefoot because I have no arch, but
yes.
My wife has like fine arches. They're no problem. So yeah, I understand what you mean. Makes sense.
And you'll also notice, like, a lot of people with those flat feet, they'll develop bunions. They'll develop painful corns. They'll have, knee pain, ankle pain. All that is related to flat feet.
So how long have you seen or people seen clinically with the titanium stent in? What happens to the person over the first year, 2, 3, 4, 5 years? Like, is there any adverse problems that happen after a while, or does it stay for X number of years, or what happens?
So I've been doing HyproCure for, I want to say, close to 10 years now, and done hundreds of those procedures. And I could count on my one hand how many times I've had to take a stent out. And usually when you have to take a stent out, it is because, one, they couldn't tolerate it. One of the biggest complications that come with this stent is something called sprained ankle syndrome, and that just means there's like a soft tissue envelope that surrounds the foot and ankle, and especially that joint. And a lot of times when you put something in there like the stent, it stretches that soft tissue envelope, and some people can't adjust to it. The majority of people adjust to it. Like, they will come into me and they're like, my ankle's hurting all the time, and I will generally give them a little cortisone injection, which decreases the inflammation, and maybe 1 or 2 injections, and they're usually better. It's after maybe 4 or 5 months, you're not getting better. I have to give you repeated injections. Then we got to reevaluate and see maybe this is not the right procedure for you. But I will tell you, even the people that I've taken that stent out, when they put their foot down, because the soft tissue has adapted, they generally do still have an arch. So, which is still, it's not as pronounced as a general, as you would say, a normal arch, but they still do have an arch. They have improvement than what they had before.
Okay. So what are some other therapies you're doing that you're seeing a lot of promise in?
Oh, yeah, I have. One thing I try to do in my practice, I always try to, I like toys, so I try to update the type of toys, and I try to continually educating myself on the different procedures that's out there. So one of the big things that I do in my office is something called laser therapy, laser treatments. So I use a grade 4 medical laser, and this laser is used for a lot of different treatments. Like, let's give an example of plantar fasciitis, heel pain. That's a big one. See that a lot, and it can be debilitating for a lot of people, and some people have it for years, and it's on and off. So, of course, we look at all the factors that can cause it, like a flat foot or a high arch foot or injury, or maybe they put on a couple of pounds and, it's just more pressure. That's possible. So my go-to, when you first come to me for heel pain, of course, I'll evaluate you. I'll take x-rays. I'll make sure that there's nothing else going on with the bone and make sure that it is just plantar fasciitis. So plantar, bottom of the foot, fascia is the soft tissue that inserts in that heel bone. And, of course, itis is inflammation. So the first thing we'll do is we'll give you of course, the general frozen water bottle, roll it on the bottom of your foot, stretch, and look at the types of shoes you're wearing. But and of course, cortisone injections. But those cortisone injections hurt. So they have their place, but this laser is a great way. It helps to decrease inflammation. It increases the range of motion of the soft tissue that's tight, and it relaxes the muscles that are around the area of the soft tissue and the fascia, and it really makes a difference in the pain. And it's generally a culmination of laser treatments. I generally do it especially for heel pain, which is one of my most common problems we treat. I usually do around 6 to 12 treatments, along with other things. I don't want to make it come across like I just put this laser on you and magically you're healed. That's not the way it works. It's a part of the treatment plan. The stretching, the ice. I like night splints. Shoes are important, but they come in, takes about maybe 10, 15 minutes for treatment, and we try to do at least 3 a week. And basically, they sit in the chair and they let the laser do its thing. We do a treatment on the back of the leg behind the knee all the way down to the heel, because that muscle in the back of the leg if it's tight, the bottom of the leg is tight. So if I decrease the tightness of those muscles, increase the range of motion, it takes pressure off the heel. So that laser just relaxes everything, decreases the inflammation, and gets that soreness and pain out of that area. It works lovely for plantar fasciitis without giving repeated painful cortisone injections.
Yeah, it's weird. Why does the laser decrease the inflammation?
So the laser, the light, basically the photons, little packets of energy, penetrates the skin, and it's absorbed by the cells, and it converts the energy, basically takes those cells. It makes the which is something called the cell membrane, and it alters it. It puts that energy in the mitochondria, and it stimulates that cell. The mitochondria, of course, is the powerhouse of the cell, but those photons put little packets of energy called joules in that mitochondria, and it just stimulates stimulates ATP, which is adenosine triphosphate. It's just another energy packet. It stimulates increased DNA and RNA synthesis and collagen, all these byproducts that are in the cell, and it calls those growth factors to come in there and basically start doing their job, decreasing inflammation.
Okay, interesting. Do you find that, you consider yourself a podiatrist, or are you called something else? Do you have other designations?
Which is funny because, podiatrist, that's what I consider myself. But you'll say podiatric physician, foot and ankle surgeon. They'll call that. I'm a podiatrist, but I just happen to do everything. I'm a surgical podiatrist, but I'm also a general podiatrist. I see everything when it comes to the foot and ankle.
Do you see that podiatrists do much of what you do, or most of them just do the traditional work?
So one thing I've tried to do throughout my career is differentiate myself from the others, because there's a podiatrist on every other corner. It's not hard to find a podiatrist, and we're trained in one way. And a lot of podiatrists, I find, and I'm not speaking for all of them, they have tunnel vision. You are trained to do one procedure one way, and that's the way it's supposed to be done, and there's no veering from that. And I always had a problem with that. That's just not me. Anybody who knows me, that's not what I do. And I try to treat people the way I would want to be treated, and I want to have a slew of different treatment options for you. So if you come to me, or if I'm going to my doctor and he says, well, you have this problem with you, and all right, we're going to start treating you, and I'm just not getting better. Well, I want to have options. I want you to be able to place options in front of me. Well, okay, we could go this route, or we can go this route, or we could go this route. And that's what I try to do. I try to have at least 4 to 5 different treatments for any ailment that comes in my practice, because what I do know is that one size does not fit all for everybody. There are some people who come in for heel pain, and I give them injection. They don't get better, and you'll find patients who will come to you and say, I had heel pain and my doctor gave me 13 injections. That's crazy to me. Why, for one, if I'm still in pain after all this time, I would expect my doctor to take a step back and say, okay, this might not be the problem, or you're not responding to this. Let's find something different. I don't want to be 3 months down the road and I'm doing the same thing over and over again, or I'm just not getting better. So that's why
right.
I think what differentiates me from other podiatrists, especially in my area, is that I think outside the box. That's when I came. It took me a while to master minimally invasive procedures, because it's not something that you're just going to read a book and boom, you're good at. It doesn't work that way.
Right.
You really have to train at it. And that option, after seeing the long healing time and the pain that people go through, it just made me. I don't do any open procedures anymore. The only procedures I do in my practice are minimally invasive. There's no reason for me to do an open procedure, because my procedures work for just about any bunion or any flat foot or hammer toe or plantar fascia release.
So, all right, so what areas do you serve? I mean, how big of a radius, and where are you located, and maybe some referrals or references for people that can't get to you?
So, my main practice is in Richland Hills, Texas. I do have an associate who works out of Weatherford, and we collaborate. We have meetings, and we'll discuss different cases and different options on how to treat patients. But so I draw from the Dallas-Fort Worth areas. But I've had people, for example, for that hyperocure procedure, I had a young lady come from Brazil to get it done. So there's nothing stopping you from, if you're in another state, to come say, hey, I want to find out more about your minimally invasive bunion procedure, because not a lot of podiatrists do it. It saves you time, because you have a quicker heal time, saves you money because you don't have to pay for the hospital stay and large anesthesia costs, and plus you'll have less pain and you'll get a very nice outcome.
Yeah, that's great.
So I draw from the Dallas-Fort Worth area, but I get them from all over Texas, as well as I get them from New Mexico. I've had them come from everywhere.
Okay. So what's ahead for you? What are you going to work on next, over the next year or so?
Oh, yes. So one of the biggest issues that I see in my practice is diabetic. And diabetics, and not just diabetics, people love to go get pedicures. The problem with pedicures is that it's tough to find a place where you can get a safe pedicure. And when I mean safe, I mean, are you sure they're autoclaving their instruments? Are you sure the person that is working on your foot is the person whose license is on the wall? Are you sure that the environment is clean? Are you sure that they're putting their feet in these water baths and they're getting all these nasty infections, or are they're spreading, they're getting warts? So my venture is, and I'm working with, yes, and it's a shame, because who doesn't love pedicures? Pedicures are relaxing. They have their place, and I'm not just talking from a cosmetic standpoint. I'm talking about from a relaxation standpoint when they do the massage on your legs, or I think it's a wonderful, wonderful service. So what I'm doing is I'm teaming up with around the country. Actually, right now I'm in Florida and Georgia. I'm doing telemedicine. So I've teamed up with these medical nail technicians. They are nail technicians who went and got extra training in regards to foot health and how to perform their procedures or their work in a safe environment. So basically, they see fungal nails every day, all day, but they're really not supposed to touch them. The laws say you should not touch a unhealthy nail. So what I am doing is I'm starting my little clinic in their facility, and basically I will do a telemedicine consultation, and we will treat their toenail fungus, or I'll do a foot evaluation, and I will if they have any concerns, I can point them out and point them in the right direction to getting that fixed. And it's a quick consultation. It's not like it's going to take an hour because, they're getting a pedicure. And what I try to do is I make it affordable so people are able to get this consultation and also the pedicure. And the medical nail technician now takes it on and they start to actually treat the toenail fungus via topicals, not oral medication, but topical medications. So they give a nice pedicure and they'll actually employ the medications in the toenail while they're given the pedicure. And that's my new venture. I'd like to revolutionize the nail salon industry where we make them start to autoclave and up their training. I believe that all nail technicians should have that medical aspect of it because you are dealing with people, and a lot of times you're dealing with diabetics. Sometimes you find you go to the nail salon and they're cutting your ingrown toenail out. Now, 9 times out of 10, that's not a bad thing. It helps you, but it's that one time that you get that MRSA infection, which I've seen, or you get a viral infection. So a lot of horrible things can come from some of these nail salon places, and I think that there's a place for a fusion of podiatry and nail salons, cosmetic podiatry, I like to call it.
No, that makes sense. So if you do the consult, does that because the people in the salon are able to apply topical medication because it's under your direction?
Exactly. They're able to apply, and also, we can also do. They could also take little chips of the nail if we want to confirm that it's a fungus, and send it to a pathology lab. And I have a friend who happens to be a podologist we're working with, so we can do it affordably if they don't have insurance. So that's my next big venture, and I'd like to in the next couple years, I'd like to be all over the country doing telemedicine consults and just have a team of doctors working with these salons, especially retired doctors, and just do consultations and actually force those nail salons that are not acting or performing in the best interests of their clients and force them out of business or make them step up their game. That's my vision.
Makes a lot of sense. That's great. Okay. So what's the best way for folks to get in contact with you?
So I have a website, which is Woodly, WOODLY, foot and ankle spelled out.com with all my contact information. Or they can also call my office. My direct office number is 817-284-8271. Or they can send us an email at info, INFO, at woodlyfootandankle.com, spelled out, WOODLY, footandankle.com.
Okay, well, very good. Dr. Woodley, that's great. I'm glad that you're doing all this stuff, and it's much better than sounds like what's out there right now. So thanks for coming on the podcast and letting me know.
I really appreciate you having me and letting me, because I love to talk, and let me talk. Again, I can't thank you enough for doing this.
You have been listening to Almost Here, Around the Corner Future Technology podcast with Richard Jacobs. Subscribe to this podcast, post a review to discover more future technologies that are poised to transform our lives for better or worse, such as Bitcoin, artificial intelligence, 3D printing, blockchain, virtual reality, and more.